Well, spring's here, summer can't be far behind, so here's a question for you. Are your feet ready for sandal season? Or are you jamming something nasty inside those socks and shoes? As Aaron Glazier shows us tonight, from corns and calluses to ingrown toenails, there is help for tarnished toes out there.
I think they're ugly and flat. On the center, I have this sharp pain there. I have no idea what it is.
Sound familiar? If you have foot pain, you're not alone. Sole specialists say soreness shouldn't be a fact of life.
63% of the population believe it's normal to have tired or sore feet at the end of the day. If you're on them all day, it isn't.
Despite thinking we may take good care of our feet, evidence on the streets proves otherwise.
Ooh, I don't know, what's that?
It's a blister for my boot, hiking without shocks on. But, you know, you got to take care of it. It's like your hands. You use them for what they're meant to be, carrying yourself around.
The causes of foot pain can vary, from wearing ill-fitting shoes that give you calluses or corns to not enough arch support, which can spur plantar fasciitis or heel pain. But doctors who deal in feet say there are some conditions we're just born with.
A bunion deformity, the cause of it is biomechanics, which is hereditary most of the time. Roughly a third of the population inherit a stable foot mechanically. They'll never need orthotics, they'll never get bunions, hammer toes, heel spurs, any of these problems that are directly related to mechanics. The other 2/3 of us have varying degrees of instability.
Murchoff says most patients will wait 3 months or more struggling with foot pain before seeking a diagnosis.
She's developing a little bunion joint problem here, which is obvious on the right and not so much on the left. If you look at her foot structure, the 2 feet aren't exactly the same.
A painful ingrown toenail or bunion will often need surgery to correct, but non-surgical options such as orthotics are also available by custom casting the foot.
And try and keep that heel perpendicular to the ground when they're walking, and then support the foot there so that it stabilizes it and decreases that motion that shouldn't be occurring.
So if you're experiencing foot pain, simply inserting anything into your shoe may not be enough. A doctor of podiatric medicine can build you an orthotic specific to your feet's biomechanical needs.
It's a little frustrating because anybody can make orthotics. And I see people who think they have orthotics that they're not anything close to what I would call it.
And Murchoff says properly fit orthotics will stop your dogs from barking for years to come.
Basically, they've changed my life because I can get around without any foot pain. I'm a lot more comfortable, and because of my foot, I definitely need orthotics.
In Victoria, Aaron Glazier, A News.